Hi, I'm Dr. Mickey Barber with Better Life Carolinas, and I want to talk to you today about memory. It is the number one concern of all of us as we age is losing our mind, losing our memory, not being able to take care of ourselves. Dementia and cognitive impairment is going to be the number one chronic disease in our country within the next 5 years. We have to do something about recognizing it early when we can do something about it. Because right now, there is no FDA approved treatment for Alzheimer's disease or for dementia that actually works. So, what can you do about it? I mean, most of us have days when, we can't remember where we put our keys or we can't remember what we had for dinner the night before. Those kinds of things are probably okay. But you need to be working with a health team that can really talk to you about, is your memory impaired? And if it is, what can we do about it? Well, one of the things that we offer that is very helpful is every year we have our patients take a cognitive function test. It's a simple test. It's done on a laptop computer in our office, and it looks at visual, verbal, composite memory, immediate and delayed. So it's looking at short and long term. And then we chart that every year because that's what's really important. Hopefully, when we see you the first time, everything is great. And hopefully, every year when we repeat it, everything is great. But if we notice a decline in your test results, then we want to get on that right away. And we have seen that. We have actually diagnosed early dementia. We've diagnosed early Alzheimer's. We've diagnosed mild cognitive impairment through using that test and also talking to the patient and many times talking to their family. Because guess what? A lot of people who are having some early signs of dementia or mild cognitive impairment cover it up, and they're really good at hiding it. So we want to be able to help you early on. Well, what can we do about it? Well, first we need to uncover what is causing that. And there can be a lot of causes. Stress itself can affect your memory by affecting all the neurotransmitters and chemicals in your brain. Your diet, if you're having big fluctuations in your blood sugar, if you're diabetic or if you suffer from hypoglycemia or if you binge on carbohydrates, that can affect your brain. Heart disease, if you're in atrial fibrillation or your heart's not beating right or your blood pressure is off, guess what? That can affect blood flow to your brain as well. History of a concussion, so traumatic brain injury or TBI, even if it was just a simple small knock in the head that didn't knock you unconscious, you can have dementia and cognitive impairments years later. So we want to figure all of that out. Inflammation, we know particularly with TBI, traumatic brain injury, a lot of the later sequela is due to inflammation that happens right when the injury happens. So we're going to do a whole panel of different labs and things to really dig in and see if you're having real cognitive impairment, dementia, what could be the possible etiology from that? Could it be vitamin or mineral deficiencies? The B vitamins, B12 in particular, have a lot to do with neurologic function. Statin medications. I've had 2 patients who came in with mild cognitive impairment that we found was due to the statin medications they were on and a cholesterol that had been driven so low that the brain was not really functioning at the same level. So figuring that out and then coming up with a specific treatment plan for you is extremely important, and probably just as important if you have people in your family that had or have dementia or had or have Alzheimer's disease. We need to be getting you on a proactive brain healthy program right out of the gate. And by brain healthy, I mean that includes eating healthy fats. It means cutting down on sugars. It means absolutely eliminating artificial sweeteners from your life. So that's good for anybody, but particularly if you think that you have a genetic risk for dementia or Alzheimer's disease, we need to be getting you on a program before those things start to happen. So that's what a proactive age management medical program is about, is not just taking care of the problem when it occurs, but really preventing the problem from occurring. So don't be afraid. Now, a lot of people, are out there probably watching this thinking, well, I'm forgetting things, but, what are they going to do? How are they going to help me? Don't take that approach. I mean, I guarantee you, we will work with you and we will help to find a way to improve your quality of life. And if you're not having problems now, we don't want you to be a statistic. The number of people suffering from cognitive impairment and dementia is going up every year. It's a real problem. It's a real health crisis. It's a real financial burden for the healthcare world and for our country. And so we want to do whatever we can to really prevent that early on. Part of what we do is assess your hormone levels as well. DHEA, for example, I would say the most misunderstood and underappreciated hormone we have in our body, is very important for memory and cognitive function. So we're going to look at that in particular. In women, estrogen can have a big impact on our brain and our brain function. Testosterone in both men and women, growth hormone, cortisol, that stress hormone, all of that can affect how all those neurons fire in your brain. We know the hippocampus, which is the memory center, does not function as well with high levels of cortisol, the stress hormone, and low levels of DHEA. And guess what? When you're highly stressed and your cortisol is higher, your body naturally produces less DHEA. So it sets that up for the hippocampus, that memory center, to not work as well. So we're going to work with you. We're going to do a lot of different lab tests. We're going to get to know you. We're going to talk about, exactly what you're concerned about as far as your cognitive function. And most importantly, I think, is that we're going to assess that through testing and then put together a healthy brain health program just for you. So call us at Better Life Carolinas. Our number is 843-737-2597. We look forward to seeing you.